The Trump administration is trying to make it a lot harder to go to graduate school and get an advanced education if you don't come from a wealthy family. Because up until now, if you were getting an advanced degree, becoming a nurse practitioner or a physician assistant or a physical therapist or a school counselor, you could borrow the money you needed to pay for school and then you paid it back with interest. That's how people without wealthy parents became scientists or healthcare providers or mental health professionals. But tucked into Trump's big beautiful bill is the elimination of those loans. And instead, the bill creates strict caps on how much graduate students can borrow. And what's wild is that they've now created 2 tiers of graduate students. Tier 1 is a very small set of degrees the administration decided count as professional, including medicine, dentistry, pharmacy, chiropractors, and theology. But everything else is no longer considered a professional degree, and so they're capped at borrowing $20,500 a year, even if their program costs 2 or 3 times that. And guess which degrees are suddenly not considered professional? Nursing, nurse practitioners, physician assistants, counseling and therapy, social work, public health, education. Almost every single one is a female-dominated field. Almost every single one is essential to health equity, meaning the basic idea that everyone deserves a fair chance to be healthy. And almost every single one costs far more than $20,500 per year to attend. So the obvious impact is that students in these professions, which are overwhelmingly women, often first generation, often coming from the same communities they then go back to serve, will no longer be able to borrow enough to enter these fields at all. They simply won't be able to afford it. And this tracks exactly with the Project 2025 playbook, which aims to shrink federal financing for graduate education, especially for care-based, female-dominated, equity-focused professions that aren't geared toward corporate profit. So if you care about having enough nurses, NPs, therapists, mental health care providers, speech therapists, school counselors, this affects you. If you care about kids, older adults, disabled people, rural communities, maternal health, mental health, this affects you. And even if you don't care about any of those things, this affects you. Because if you cut off the pipeline for care-based professions, you guarantee a sicker, more unequal America, which is bad for all of us.